Hello everyone. Today let's discuss about the anatomy of the femoral triangle. This topic can be discussed under the following headings: Introduction, Boundaries, Contents and Clinical Significance. Femoral triangle is a triangular depression on the upper one-third of front of thigh immediately below the linguinal ligament. It is bounded laterally by the medial border of the sartorius, medially by the medial border of the adductor longus, and above by the base of the inguinal ligament. Laterally sartorius, medially adductor longus, and above inguinal ligament. This can be remembered by the mnemonic SAIL: S for sartorius, A for adductor longus, and IL for inguinal ligament. Coming to the roof and floor of the femoral triangle. The roof is formed by skin, superficial fascia, and the deep fascia, which is fascia lata. The floor is formed from lateral to medial by the iliacus, tendon of psoas major, pectineus, and adductor longus. The lowermost part of the floor is formed by the capsule of the hip joint and the head of the femur. Now let us talk about the contents of the femoral triangle. They are: in nerves, femoral nerve, nerve to pectineus, which is branch of femoral nerve above the inguinal ligament, femoral branch of genitofemoral nerve, which is a cutaneous nerve, lateral cutaneous nerve of thigh, which supplies the anterolateral part of thigh and lateral part of the gluteal region, femoral artery and its branches, femoral vein and its tributaries, mainly the great saphenous vein, and the lymphatics, which are arranged in T shape. The femoral artery, the femoral vein, and the lymphatics are arranged in a structure called as femoral sheath. Femoral sheath. Femoral sheath is a funnel-shaped sleeve of fascia enclosing the upper 3 to 4 cm of the femoral vessels. Anteriorly, it is formed by the fascia transversalis and posteriorly by the fascia iliaca. This is the femoral sheath. It is divided into 3 compartments: the arterial compartment, the venous compartment, and the lymphatic compartment. The arterial compartment contains the femoral artery and the femoral branch of genitofemoral nerve. Venous compartment contains the femoral vein, and the lymphatic compartment contains the lymph node of Cloquet or Rosenmuller. The upper part of the femoral sheath is called the femoral ring. The femoral nerve lies lateral to the femoral sheath, and it is not enclosed by the femoral sheath because of the chances of compression of the nerve. So let's see the branches of femoral artery in the femoral triangle. The femoral artery divides into superficial branches and deep branches. There are 3 superficial branches: the superficial circumflex iliac, the superficial epigastric, the superficial external pudendal artery. And the deep branches are the profunda femoris with medial and lateral circumflex femoral branches, and the deep external pudendal artery, and the muscular branches. Clinical significance of femoral triangle. Femoral artery present in the femoral triangle easily gives access to major arteries, as it is a continuation of external iliac artery. So coronary angioplasty can be done. We can feel femoral pulsations against the midinguinal point. As we can locate the femoral artery, medial to it lies the femoral vein. Venipuncture can be done. Femoral hernia. The femoral canal is an area of potential weakness in the abdominal wall through which the abdominal contents may bulge out, forming a femoral hernia. A femoral hernia is more common in the females because the femoral canal is wider, which is associated with the wide pelvis and smaller size of femoral vessels in the female. It is not congenital. Meralgia paresthetica. The lateral cutaneous nerve of thigh may get entangled with the inguinal ligament, which leads to pain in the lateral side of the thigh. This is called meralgia paresthetica.